Hi, Dr. Stern here, and today I'm going to answer Noelle's question. She wanted to know what she could do naturally for PCOS. Now, it's a great question because there are so many women suffering with this condition out there. So I decided this is what I'm going to do. I'm going to break it down exactly what PCOS is real quick, how to test for it to make sure you have it, and then I'm going to give her and you natural solutions, dietary guidelines, supplements that she could do to make sure that this condition is taken care of naturally. It's actually the #1 endocrine disorder in women. It's the #1 cause of infertility in women. And so it's a huge problem that women face today. And let's get down to it and get her feeling better and get everyone out there feeling better. So, what is PCOS? PCOS stands for polycystic ovarian syndrome. It is, again, the #1 cause of infertility in women, but it also presents so many other troubling symptoms: hair loss, increased facial hair, really almost impossible to lose weight, especially body fat, belly fat, acne, and of course missed periods, a regular menstrual cycle. It's just a tremendously troubling condition, and half the women out there don't even know it. They haven't been diagnosed. So basically what PCOS is that there's too much androgens, basically testosterone, and that disrupts the whole endocrine system. A woman's ovaries throughout the month have these follicles, and one follicle will mature and become an egg. That's the egg that's fertilized by the sperm and then can become a baby. Or if not fertilized, the woman has a menstrual cycle and it starts all over again. For women with PCOS, these eggs never mature. It's just a bunch of follicles that don't mature into an egg. And that's where it stands for polycystic. It's not really cystic, it's really polyfollicular. There's just a lot of follicles, and one of them isn't becoming an egg. And so these hormones are out of balance. So this is where you could do your testing to see if you have PCOS. So the tests that I send my patients for are, #1, send them for a sonogram. See if there's a lot of follicles. If there's a lot of follicles around mid-cycle and there's no egg being released, that woman most likely has PCOS. Also, a blood test. Look at the hormones. So again, women with PCOS have high androgens, high testosterone. So check for free and total testosterone. If it's high, most likely this woman has PCOS. Now, the high testosterone levels, high androgen levels, are usually caused by something called insulin resistance. Actually, over 70% of all women with PCOS have insulin resistance. Now, what is that? So this is how it goes. When women eat, or anybody eats carbohydrates, that breaks down into sugar. And for sugar to be used as energy, it needs to get into our cells. The way we get sugar into cells is a hormone called insulin. So insulin is released by the pancreas. It attaches to the cell, opens the cell up like you're opening up a door, and the glucose walks right into the cell. If the insulin is not attaching to the cell properly, if the cell is not responding to insulin, the body keeps making more and more insulin. As the insulin levels rise, that is what disrupts the endocrine system. It causes the increased testosterone and can cause PCOS. So, this is what you should do. The last test I send women for is a 2-hour insulin glucose tolerance test. Now, a lot of doctors out there, when they're looking for PCOS, know this information. So they look for fasting glucose levels. But if you're in your teenage years, your young 20s, even if you're in your 30s, the glucose levels a lot of times will still be normal because your body sugar levels, fasting sugar, is not that bad. For a lot of women with insulin resistance, their normal fasting sugars are okay. The problem is that their insulin levels will rise too high, and you can't check for that unless you do a 2-hour insulin glucose tolerance test. So make sure that that is what you ask your doctor for when you're looking for PCOS, along with, again, all these troubling symptoms that a woman will present with. Now, once all the tests have been done, you figure out you have high testosterone or you have polyfollicles, you're not getting your menstrual cycle, and you do a 2-hour insulin glucose tolerance test, you have insulin resistance. This is what you're going to do. This is the natural treatment that you're going to do. Number one, you have to change your diet. For insulin resistance, the key to that is pretty basic. You have to cut out sugar, sweeteners, and basically all carbohydrates above 50 on the glycemic index. So when we eat carbohydrates, it responds different carbohydrates respond differently in our body. And so if it's high on the glycemic index, that's going to cause a spike in insulin. So we don't want that. We want to have lower glycemic index carbohydrates. Some examples: sweet potatoes, vegetables, most fruits, quinoa, those types of grains that are not gluten-based, carbohydrates that have fiber. Those are carbohydrates that are going to be lower on the glycemic index. Oatmeal that's slow cooked, for example, is a lower glycemic index carbohydrate, whereas instant oatmeal is a higher glycemic index carbohydrate. There's a lot of charts out there that you can look at and get a real good understanding of what not to eat and what to eat when it comes to carbohydrates. Also, make sure you're getting plenty of protein, good fats. Omega-3 fats are really important when it comes to making sure that the endocrine system and that your hormones are balanced naturally. Walnuts, flaxseed, fish oil, or if you're going to eat it, salmon, wild-caught salmon is amazing. So make sure you're getting your good essential fats. Also, your omega-9 fats in olive oil and avocado oil or avocados, really healthy for the body. So your fats are important, your protein's important. Make sure though, when you're getting your protein, if in the form of meat, make sure it's grass-fed meat or free-range meat when it comes to chicken or turkey. If you're having dairy, again, make sure that it's coming from grass-fed cows. Do not eat conventional meat and dairy that eat grains and are not eating grass, because those grains have been treated with something called Roundup. Roundup has a chemical in there that's an herbicide that actually disrupts the endocrine system. They call them endocrine disruptors, and that can lead to PCOS. So make sure that you're eating organic food, and make sure that when it comes to meat and dairy, you're eating free range and grass-fed. All right? That is basically the diet. Now, when it comes to supplements, I break my supplements for women with PCOS down into 3 categories. The first, there's some supplements specifically for insulin resistance. Number 1 is alpha lipoic acid. You want to do 600 milligrams a day of that, 200 milligrams 3 times a day. Second one is a mineral called chromium. That you want to do 200 micrograms 3 times a day. The third one is an amazing B vitamin, or they call it a B vitamin-like nutrient. It's called inositol. Now, inositol, just by itself, without anything else being tested, has been shown to increase fertility in women because it helps with insulin resistance. Now, there's 9 types of inositol out there. The 2 most common that you're going to find are myo-inositol and D-chiroinositol. What you want is you want a 40-to-1 ratio of myo-inositol to D-chiroinositol. So there are products out there that are 100% myo-inositol, 100% D-chiroinositol. You want the ratio 40-to-1 myo-inositol, D-chiroinositol. That's the type of inositol you want. It helps with insulin sensitivity, it helps with PCOS, and you'll see some really tremendous endocrine and metabolic benefits with weight loss and with a lot of the symptoms, again, including getting pregnant. The fourth thing is magnesium. Magnesium is wonderful for increasing insulin sensitivity. The second thing is you want to really help balance out the adrenal system. It's been shown that adrenal gland hormone release, cortisol, the cortisol increases belly fat, can definitely cause insulin resistance, which can then trigger PCOS. So you want to help decrease the stress and balance out the cortisol. 2 products I recommend. Number 1, ashwagandha, wonderful adaptogenic herb that helps decrease cortisol levels, balance out the adrenal glands. And the second thing is a formula I made myself called Relax. It's a nighttime formula that has 2 amazing herbs that help lower cortisol levels, holy basil and magnolia. So those are the products I recommend for the adrenal glands. The Relax formula that I created, and then in the morning time, ashwagandha. Now, it's also good for the adrenal glands to reduce stress and cortisol by doing some lifestyle modifications like meditation and exercise. Those 2 things have been shown to balance out the adrenal glands, and exercise has also been shown to help improve insulin resistance. So it's a 2-for-1 with exercise. A, you help the adrenal glands and lower cortisol, and B, you help insulin resistance. All right, so those are supplements I recommend for the adrenal glands. And then the third set of supplements I recommend are to help kind of balance out the reproductive hormones. Again, progesterone is low with people that have PCOS. So I like something called chase tree berry that helps boost progesterone levels up. I usually recommend it to women about 2 weeks a month from the moment they ovulate on. Now, if you're out there and you're not ovulating and you're not having your menstrual cycle, then take it for 2 weeks on, 2 weeks off, and the body will start creating a normalcy, a normal pattern, and then you'll be able to kind of have a better idea of when you should take it and when you should not take it. And then the last supplement herb that I recommend for hormonal balance is maca root. Great South American herb that really helps balance the reproductive system and get the estrogen and progesterone levels back into balance. So I know that's a lot. PCOS is a pretty complicated condition, but this is what you want to take from it. It's definitely a troubling condition, but it's definitely fixable. You want to really balance out your hormonal levels through diet and supplements. Definitely work on the insulin resistance. Make sure you're really decreasing those sugars, getting all of those essential nutrients through fruits and vegetables, nuts and seeds, good grass-fed meat and grass-fed dairy if you do have dairy. Make sure you're getting good fats. That's the kind of foods you want. All the supplements I recommended to help the adrenal glands, to help insulin sensitivity, and to help the reproductive hormones such as the maca root and the chase tree berry, and you will really do amazing. Now, before I go, one last thing that I want to talk about, another quick lifestyle change, is there's a lot of xenoestrogens out there. Not a lot of people talk about it, but plastic bottles, metal cans, those have something in it called BPA, which are, again, endocrine disruptors and can trigger PCOS because they totally mess up the whole endocrine system. So try to stay away from plastic and cans, aluminum cans. Try to go more with glass bottles, and make sure you're buying food that's trying not to come in packages, whether it's plastic or aluminum or metal. All right? So those are a couple last tidbits, and I hope this helps. Again, I know PCOS can be very troubling, but if you do all these suggestions, you should really see amazing results. And reach out. I look forward to hearing how you do. I hope you have an amazing day.